Okay, welcome everybody. We've got Dr. David Jack with us today talking about Morpheus8 and Lumecca for facial rejuvenation. So we're going to get started now. Thank you all for joining.
Hi everybody. Nice of you all to join today, and I hope this is interesting and informative for you all. I'm not sure if everybody is Inmode customers already, or if you're kind of looking to perhaps become a customer. So I'm going to keep things relatively general at first, and then I'll show you some before and afters of my patients and explain a bit about the technology. Let me just play this slide here. Morpheus8 and Lumecca, two of the main non-surgical applicators on the Inmode platform. My background, I don't know, let me just see, I don't think you can see that. Hang on. Sorry, so I'm just going to do it this way. So my name is Dr. David Jack. I'm a cosmetic doctor working in London. I have a clinic on Harley Street in London. My background is in plastic and reconstructive surgery. I worked in the NHS doing things like burn surgery, craniofacial reconstruction, microsurgery, these sort of things. I left NHS about 6 years ago to set up a private skin clinic, and I've grown that ever since. I've had the Inmode system for about 5 years now. My machine looks a bit older than this one, but it does the same things, and I use it pretty much every day for a variety of skin issues that I see. The reason for me getting it Inmode as a platform so early on when I started my clinic was that it offered so many of the things that I was being asked for by patients. So pigmentation, skin tightening, treatments for jowls, treatments for acne scarring, these sort of things. And Inmode was one of the things that offered a lot of different solutions to these clinical problems that I was seeing. So a bit about Inmode, for those of you who are new to this, it's a multimodal platform. There are various configurations of the machine that are available. It uses radio frequency as the kind of the main thing that offers, and there's lots of different applicators, which I'll cover in a second. There is also a very high power, high quality IPL that you can have as part of the system, and also laser hair removal as well. There are more and more sort of applicators coming onto the system as the technology is updated, and the company itself is very forward thinking when it comes to new technologies. So when it comes to the different applicators, the ones from a non-surgical point of view, which I have and which are great additions to any non-surgical clinic, are the radio frequency applicators, which include Morpheus8, Fractora, Forma Plus, which is a non-ablative radio frequency technology, Body FX, Mini FX, and now Forma V, which is for vaginal rejuvenation. And then there is Lumecca IPL, which is, as I said, a very high-powered and very useful IPL system that is one of the market leaders in the world of IPL devices. There is also laser hair removal, and there is a variety of headpieces for laser hair removal, which can treat different skin types and different types of hair on different skin types. And then there are other kind of laser applicators which are being developed. So as I said, the main kind of workhorse of the main workhorse of the radio frequency of the Inmode system is the radio frequency side of things. So with Inmode, all of the technologies are bipolar radio frequency, meaning that the radio frequency delivered and captured by the handpiece is within the handpiece, rather than having to use, for example, in a monopolar device, you would have the handpiece, and then you'd have an electrode that you stick on elsewhere in the body. So bipolar radio frequency, you can kind of limit the depth of penetration, and it's also much easier to control. There is ablative and non-ablative radio frequency. Ablative radio frequency means that you're creating injuries on the skin surface in combination with the radio frequency, which is the Fractora and Morpheus8. And then non-ablative radio frequency means that you're not actually breaking the skin surface. It's more kind of gentle rejuvenation treatments where you're not actually creating injuries. Okay. So Morpheus8 and Fractora. Morpheus8 is the latest sort of updated fractional radio frequency device on the Inmode platform. Fractora is kind of its predecessor, but it's still useful for a number of clinical issues. All of them work on the principle, as I said, of creating injuries on the skin, delivering heat to the various layers of the skin, and then stimulating a rejuvenating reaction, sort of post-inflammatory response in the tissues following the treatment. With both Fractora and Morpheus8, there are a variety of different settings that you can use, and also a variety of pins that can be used for different clinical issues, and I'm going to come on to that in a second. As I said, Morpheus8 is the newest thing to come into the fractional radio frequency world. It's been lauded by the press in the States, in the UK, elsewhere in the world, because of the numerous applications and the effectiveness of the results. The unique thing about Morpheus8 is that you can penetrate up to 4 millimeters in depth. The pins are extremely thin, and they can be coated with silicone, which can decrease the amount of surface heating that you get on the skin. So if you're treating patients with darker skin types, this can reduce the risk of post-inflammatory hyperpigmentation, while still getting to those deep layers and still kind of creating the response that you're looking for. It's bipolar radio frequency, the same as all of the other radio frequency applicators on the Inmode platform. And this one can actually target as deep as the subdermal adipose tissue. So for example, under the chin or on body areas, it's very good for tightening and lifting all of the layers of the skin, including the adipose layer. And it can be used also in combination with other technologies that are offered by Inmode, including body tight and face tight, as a more superficial complementary treatment to these treatments. So the way that Fractora and Morpheus8 both work, as I said, is using pins which create injuries on the surface of the skin. They penetrate in as the radio frequency heats either from the tips, or if it's an uncoated pin, then the entire length of the pin. And as I said, this is the different pin types would be used for different clinical indications. As you get the heating, the pin goes into the skin, creates an ablative injury. You get heating from the radio frequency, and then you get an area of coagulation surrounding the area of necrosis, and then you get heating of the surrounding area to the area of coagulation. This then stimulates an inflammatory response, which in turn stimulates the fibroblasts in the dermis and deeper layers to produce new collagen, new elastin, and also reorganize the type of collagen that's there if you're treating, say a scar. Usually the whole process takes about 3 to 6 months, and over that time you'd maybe do a couple of treatments. So yes, with any patient, depending on the indication, you can plan to have a number of treatments, and you can sort of consent them and counsel them appropriately about things like downtime and what to expect in those recovery periods. The nice thing, as I said, about Morpheus8, compared to other fractional radiofrequency technologies is that the pins are extremely thin, so the injuries created are pretty pretty thin as well, obviously, and the pins are coated with silicon. If you're using coated pins, this really decreases the amount of surface heating that you're getting, and that again decreases the melanocytic response in the epidermis. So, as I said, decreases the risk of post-inflammatory hyperpigmentation, and it also decreases downtime from these treatments. Previously, with kind of uncoated pins, using Fractora or other radiofrequency ablative devices, downtime might have been about a week to 10 days in some people. With Morpheus8, you tend to find that people look kind of normal after about 3 to 5 days. So it's a really kind of advanced form of these treatments. Okay, let's move on to the next slide, if it'll let me. Yep. Okay, so indications for Morpheus8 and Fractora. So the things that patients that would be appropriate to do these things that are people that are looking for skin rejuvenating, people that are maybe slightly older who are starting to see signs of lax skin, who have maybe had some filler that's not really doing the job. You can also use these things as sort of treatments for deeper pigmentation as well, and melasma, and there's been some success in treating melasma with Morpheus8 and even Fractora. Acne treatment, acne scarring, vascular lesions, hyperhidrosis is another area that people are starting to use this sort of technology, in stretch marks, and in pockets of excess fat as well, often, as I said, in combination with some of the deeper technologies that are offered by Inmode. So there is, as I mentioned, coated and uncoated pins. So what would you use coated pins for, and what would you use uncoated pins for in this list of indications? So for skin rejuvenation and for deep kind of collagen stimulation and reduction of or tightening of the fat layer, and what you want to do is get to these deep layers without creating too much heating and too much irritation on the surface of the skin. So you would probably select for these sort of cases an uncoated pin, a coated pin, so that you reduce the risk of any sort of pigmentation or major kind of superficial inflammatory responses in the skin, and you're actually targeting the heating and much deeper into the skin without risking the reactions in the epidermal layer where the melanocytes are.
David, so I would like to interrupt. You're on slide 6. Is that the right slide, or have you moved beyond that?
This is on Morpheus8 and Fractora indications.
What slide is that? Because I think it hasn't moved beyond the radiofrequency slide.
That's strange. I've moved on a couple of times. Let me just come out of this.
Maybe try making it into slideshow mode, like full screen. I don't know if that would make a difference.
Yeah, I've done that, and it didn't seem to.
Okay.
Let me see. What I'll do, I'll just do it like this, so even though so you can just see this, because the most important thing is to see the slides. I take it you've not seen any of these slides?
Not yet, no.
Okay, so that was just what I was I've been going through the last couple of minutes, so never mind. Okay, so these are the indications that I was talking about. I'd moved on to this slide about coated versus uncoated pins, and as I was saying about so people looking for fractional skin rejuvenation, things to treat lax skin, you wanted to get to the deeper layers without necessarily causing too much heating or risk of pigmentation changes and redness on the surface of the skin, and also minimizing downtime. Same for deeper pigmentation treatments, you'd want to be using coated pins, and again penetrating deeper into the skin, and we can talk about Lumecca for pigmentation treatments as well. For treatments for scars, so things like acne lesions, also superficial vascular lesions, and even striae, you maybe want to be slightly more superficial in the skin, and also creating more of this surface inflammation and this surface heating, so that you really get a maximal amount of collagen stimulation in the more superficial layers of the dermis. So you might want to use an uncoated pin for that. The drawback of that is obviously, as I said, that you can get more surface heating and more melanocyte response and risk of pigment production. So in darker skin types, I would generally err on the side of caution and use a coated pin. Okay, let's see. For anesthesia for this treatment, if the treatments do need anesthesia, they're not comfortable to do without anything. So my choice of things to use for topical local anaesthetic, which is the way that I normally do these treatments on the face, is to use a thing called Receptura, which is a local anaesthetic that is compounded in Germany. You can get it very easily in the UK. They do ship worldwide, but any sort of equivalents are fine. This one has 23% lidocaine and 4% tetracaine. You'd usually leave that on for about 45 minutes before doing the procedure. Gives really great cover and is very effective, and most people find the treatment extremely comfortable using that. You can also use nerve blocks. If you're treating the face, then you'd want to do a combination of nerve blocks. So orbital supratrochlear if you're treating the forehead, infraorbital for mid-face, mental for around the mouth as well, and auriculotemporal for the lateral cheek. So nerve blocks are an option. I find often you'd get a little bit of patchiness sometimes when you're doing nerve blocks, so I prefer to use topical local anaesthetic. I used to always do nerve blocks, now I always use topical local anaesthetic for the face. For body areas, and particularly for under the chin, what I'll often do if I'm treating these areas in isolation is use tumescent local anaesthetic. So I use an 80-20 blend of Hartmann solution with 2% xylocaine, which has 1 in 200,000 adrenaline in it. And you would just infuse these areas and with the local anaesthetic using a cannula, and leave it for about 5 minutes, and it's almost complete anesthesia, and it's very, very comfortable to do these treatments with tumescent local anaesthetic. I'm going to just show a couple of my cases who have had treatments. Some of you who have seen my things before might have seen these, but I'll just ask not to take photos of these or store them, because patients haven't given consent for that. They've given consent to be used in the presentation, but not to be shared. So first one is a guy who is in his late 50s, actually had done treatments in the past, was just bothered by the sort of inferior jowl fat pad and his slight kind of irregular shape of his jawline, wanted to do something to improve the skin and also to lift these areas and reduce the appearance of the kind of jowling at the side of his mouth and along his jawline. So he had 2 treatments. Relatively high energy. When I say at high energy, I would usually use, for somebody who is Caucasian, about 45 joules. For the lower face area, I would generally use 3mm settings, coated pins, if we're doing a skin tightening treatment, and I usually double stack the pulses, which means that you have the pins on fixed, and then you give 2 pulses with the pins out, and this tends to give a really intense reaction. I would usually overlap by about 50%, 50 to 75% on each pulse. Sorry, each application of the handpiece. And this gives a really nice coverage, and you're effectively getting about sort of the equivalent of 3 to 4 single passes if you're single stacking. Okay, so this guy, the second picture is after 2 treatments. The treatments were about 6 weeks apart, and this is after 3 months. Next patient is slightly older. Let me just I can't try and get rid of this. It's quite distracting having that. The patient is in her 70s, I think she's 74. Main areas of concern are around about the mouth, these deep grooves along her jawline, and she didn't want to do any filler or anything, was keen to do something that's a bit more natural to lift the area. So again, I did 2 treatments about 6 weeks apart, again using the same energy settings, and she had quite a lovely result there. You can see over this is 6 months later actually, over this time she's had significant improvement in these areas here. Jawline contour looks much nicer around about the mouth, looks kind of nice and rejuvenated, and a really nice natural looking result with that. Next one is just showing a combination case of Morpheus8 with fillers. Again, 2 treatments, same sort of time apart. For the lower face area, I'd use 3 millimeters. On the cheek area, I use slightly more superficial, sometimes a slightly lower setting, maybe 35 joules. I'd still probably double stack it. Around the eyes, I would single stack, I would use a lower setting, and I would use 2 millimeters and generally sort of 2 millimeters and a lower setting on the forehead, because it's quite, it's an area that's just a bit uncomfortable sometimes for people, and it's because there's so little fat there, you maybe just don't want to penetrate quite as deeply. And then under the chin, I would use much deeper settings, and I'll talk about that in a minute. And this is in combination with a small volume of filler. So normally for a case like this, to get this sort of revolumization, you'd want to be using a good volume of fillers. So maybe sort of between 6 to 10 syringes. This one is only, I think this is 1.5 syringes of filler the first setting, and then another 1 mil later on. So total about 2.5 mils, and quite a significant improvement in nasolabial areas, in mid-face, and in the jawline as well. Next patient is somebody who had quite a lot of filler in the past. She just wasn't happy doing any more filler, was looking for a treatment that was going to improve her skin and also improve her jawline and lift the cheeks and just brighten her skin a bit. So again, similar sort of treatment protocol, 2 sessions, and then the second picture is 3 months later. You can see skin is looking so much nicer. She still has a bit of redness, but generally speaking, her skin looks nice and healthy. Jawline is improved. She's got a bit of a lift on this area here as well, and she was super happy with this, and didn't want to ever do any filler again. I should have said she's in her late 60s. And then a slightly younger patient, just to finish up here. This is somebody who, again, didn't really want to do fillers, wants to have a bit of a lift to the nasolabial area, jawline. Again, 2 sessions, about a month apart, and then this is 3 months after the second session. Again, similar protocol, and she had the whole face treated. Okay, so what I'm going to do is just move on to Lumecca, which, as I said, is the IPL that comes on the, which you can have on your Inmode platform. Lumecca is one of the highest, has had the highest peak recorded power of any IPL device on the market. So it's a very, very powerful IPL device. It's designed to treat pigmentation and also vascular lesions. So it targets melanin and it targets hemoglobin by virtue of the wavelengths of light that it uses. It uses a low pressure xenon lamp. It has built-in cooling as well, which can be used particularly if you're treating pigmentation and you want to use this as a way of kind of helping with discomfort. You can switch this off if you are treating vascular lesions and you want the blood vessels to be as dilated as they can be, so you don't want to cool the skin with this. But if it's primarily pigmentation you're treating, the cooling can be very useful because you can cool the skin before you flash the light. It can treat skin types 1 to 4 for both purposes, and there's different settings for if you're primarily vascular or you're primarily treating pigmentation. yeah, these are just the things that I was saying. It's the highest peak power of any IPL system and highest spectrum output in the peak range of hemoglobin and melanin absorption of any IPL device on the market, and it acts a bit like a pulse dye laser. Okay, so there's a choice of two hand pieces with Lumecca. There is one that is at 550 nanometers, which is designed for Fitzpatrick skin types 1 and 2, and 580 nanometers for Fitzpatrick skin types 3 and 4. There, you can set it to a short and long pulse duration. So this means that the energy is delivered, if you set it short, over a very short period of time, and then long, it's over a slightly more milliseconds, so a slightly slower delivery of energy, but you're still getting the right dose of energy delivered to treat whatever it is that you're trying to treat. And it's also got a large spot size, so 12 by 13 millimeters, so you can actually cover quite a large area in a very short space of time. To treat the whole face, usually it takes me about, I'd say, maximum 4 minutes. Often people come in and do more than just the face. They'll do the face, the neck, the décolletage, the hands, and this, I would give them maximum half-hour appointment time. And because I've been doing it for quite a while, I've got the treatment time down to, for all of those areas, less than about 15 minutes. So it's super quick, super efficient, and always I do 2 passes, one in one direction. So I'd go with the handpiece set longitudinally, and then I'd change it around and then do a horizontal pass. So you're getting a really good cover. Yeah, so actually this is a video I was going to take out. I'm just going to go on quickly to some of the results. So just some results on hands. You can see pigmentation here, gone after 1 session. It's one of my patients who actually lives in Australia, but she comes over to London sometimes for treatments, which seems crazy, but she's been my patient for a while. She had 1 treatment of Lumecca from here to here, and significant reduction in her her pigmentation there. So it's quite a powerful one. And then again, so treating the forehead here, you can see patches of deeper pigmentation and almost completely gone after 1 session. I've got some patients that have used this who have had quite bad melasma even, so deeper staining of the skin, which has worked nicely. And as I said, it can be used in darker skin as well, up to skin type 4. If you're slightly concerned about treating a darker skin, then often what I would do is pre-treat the skin with some hydroquinone for maybe about 3 to 4 weeks before doing the treatment, and maybe use a lower setting. So as I said, it comes with different handpieces. For Fitzpatrick 3 and 4, you would use a 580 nanometer setting. You would use, if you're concerned about darker skins, then you can use a longer pulse duration and cooling as well. So there's lots of different techniques that you can use to do that, and also doing a test patch initially is extremely important. Okay, so that's the presentation done. So what I'm going to do is just share my screen if I can. And then we can take some questions, and I think there is a question box that you can see. Let's see. Oh, somebody asked, did the lady from Australia have just 1 pass? She had 2 passes, but 1 treatment. So I always do a horizontal treatment and a vertical treatment. So I go over the same area twice within 1 session. But she had 2 passes, 1 treatment. Cool. Let's see. Somebody's saying this slide. It's in slide 6. Can't see the next slide. I've gone over that. Okay, and someone's saying they can't hear the audio. Can everybody hear me? Okay.
I think that's solved. That was from earlier, David. Actually.
Okay.
Is there any other questions from anyone? Any
other questions? I'm gonna just share my screen. Stop sharing screen here, and I'll.
We have got a few questions, David.
Yep.
So, what are your thoughts for Morpheus8 on hyperhidrosis?
let's see. For hyperhidrosis, I've not used it very much. I think that there are a couple of studies coming from Canada and the US. I've seen some success after a couple of treatments, but I personally haven't used it for that purpose really. Somebody has said, have you tried the 580 handpiece with hair removal? I've had patients that have had laser hair removal and also Lumecca. I would use I have the dial laser, so I would always use that for hair removal rather than IPL, because it tends to be slightly better and more specific. When you do 2 passes, do you do 1 pass long and 1 pass short? No, I keep them the same. It's just I change the direction of the handpiece orientation, and I do overlap with Lumecca a little bit as well. It's Ian Strawford asking about the Morpheus8 for hyperhidrosis of hands. Oh, I think that would be quite painful. Definitely, I would do median nerve blocks for that one, and radio and ulnar nerve blocks. I think it would be, yeah, it's quite brave to do that. Let's see some examples of power levels for vascular and pigmentation. Yep. So let me just see if I can. Yeah, everybody can hopefully see me here. So let's see. For vascular lesions and pigmentation, so generally speaking, this depends on skin type. Always for pigmentation, if it's the primary treatment is being done for pigmentation, then I would use cooling settings. I would use, if it's skin types 1 and 2, I would use a short pulse duration, and I would use generally energies between about 14 to 18 joules. Relatively high. If it's somebody with skin type 3 or 4, 580 nanometers, I would probably do a trial at about 12 joules with a short pulse duration initially, and make sure just on an area like there that the skin isn't going to react, and then give it a day or so. If it's not reacted, then do the full face. With pigmentation again, the setting would be on for cooling. For vascular lesions, you can use no cooling. For skin types 1 and 2, 550 nanometers, skin types 3 and 4, 580. And sometimes I find you'd use it ever so slightly higher energy for vascular lesions, particularly if it looks quite deep. And I'd maybe use between sort of 14 to 18 again. There's 1 or 2 people I've used 20 on, but I wouldn't recommend doing that routinely. Okay, I hope that's answered the question. All right, settings for striae treatment with Morpheus8. So I would use generally 4 millimeters, and I would use a coated pin, high energy, and then I would go over it again with an uncoated pin at 30 joules. So high energy, I'd say it's at 45 joules, and then uncoated, the limit to that is 30 joules. So I would go to the limit with that. And usually you'd be doing maybe 3 or 4, if not more, treatments for striae. Treating melasma with Lumecca. It can be. I have had a few patients, and it is a contraindication officially, but I have actually treated some people quite successfully who have had other treatments with melasma. Always pre-treated them with hydroquinone, and it has worked quite well. So if you're feeling brave, then it's something maybe to try. But I would always do a test patch and yeah, just be sensible. I wouldn't do it in somebody with really dark skin, but if it's somebody with lighter skin and dark melasma, sometimes it can work. But you'd obviously have to consent initially to say that it could make it worse. But as I said, I've probably got about 30 patients who I've actually treated quite successfully with this, but test patch, consent them, and pre-treat as well with hydroquinone. Advantages of Morpheus8 over Fractora are that Morpheus8 can go deeper. You can treat more things with Morpheus8. Fractora is great for, for superficially treating things like acne scarring with uncoated pins, very similar to uncoated Morpheus8 pins, but Morpheus8, you can get deeper into the skin. You can treat these areas very nicely. And also Morpheus8, as I said, because the pins are coated and the way that the lattice pattern of the handpiece is, it creates less surface heating and less risk of pigmentation and less downtime as well. Would you combine IPL and Morpheus8 as a part of it? Absolutely, yeah. That's the nice thing about this platform, is that you don't need to buy two machines to do these things. If somebody has like skin laxity and pigmentation, for example, or skin laxity and thread veins, which often is the case, you're always treating multiple issues, then you can absolutely combine that. I would never do them on the same day, but yeah, maybe sort of 2 to 3 weeks apart or something. Is absolutely fine. Oh, and Ian asked the same thing. Yeah, we didn't do them in the same session. I just think you're just risking too much inflammation and risk of burns and these sort of things. So yeah, I'm relatively cavalier when it comes to certain things, but I think just these sort of things, you're just is a bit of a risk to do both at once. Morpheus8 for melasma. So you're generally speaking, you're wanting to go quite deep into the skin for it. So if you're treating an area on the face, so 3 millimeters, and you would use maybe a sort of lowish energy setting, so about sort of say 25 to 35 joules. And with Lumecca, generally you need to use relatively high settings, and as I said, it's mostly in paler people that I've tried this. So high settings being between kind of between 14 to 18 joules. Energy for around eyes and Morpheus8, I would say between about sort of 20 to 35 maximum. As I said, I do just single pulses in this area. I don't stack, just because the skin's a bit thinner, it can be a bit more sensitive. And this area is always prone to bruising as well. Can you combine? Yeah, I've answered that already. Results for Lumecca and melasma can be actually quite nice, but as I said, usually on lighter skin, I think on darker skin, because of the energy that you've got to use to make a difference, it's a bit risky. Stretch marks, yeah, I've treated quite a lot of people with stretch marks, and one of the most popular areas that I get asked about for Morpheus8 is actually the abdomen post-pregnancy and post-C-section. Often there will be stretch marks there as well, and these do tend to improve over time. As I said, generally you'd need to do sort of 3-4 sessions, if not more, to see a difference with those. Uncoated for darker skin, I mean, generally with darker skin types, you're at higher risk of post-inflammatory hyperpigmentation whenever you're doing something that's creating inflammation on the surface of the skin, and that's causing this melanocyte response. So you generally, for darker skin, want to be using coated pins just to reduce that risk. Do you see subcutaneous fat reduction with Morpheus8? Very, I mean, it's very low risk of this unless you're doing a deeper treatment where you're actually trying to target the subcutaneous fat. As I said, over the cheeks and the forehead and around the eyes, I do slightly more superficial treatments. So usually 2 millimeters in this area around the eyes and the forehead, just because you just really want to be in the dermis for this, because the heat from the radio frequency is being released over just milliseconds, and it's not a sustained heat the way it would be, say, if you're doing a non-ablative radio frequency treatment. Then the risk of fat reduction, if you're just targeting the dermis, is very low. The fat reduction in this area that you're getting with 4 millimeter treatments is because you're trying to create some fibrosis and tightening in the fat layer, rather than it's not necessarily just about killing fat cells. so that's why this area can kind of tighten and lift with that treatment. It's not so much about fat reduction. And because if you're using superficial, sort of just dermal treatments, the length of time that you're heating for is so little that the risk of fat reduction is very low. How long does the patient need a follow-up after a complete Morpheus8 treatment? I'd usually see people about 3 months later, and then again 6 months later for photographs. Can Morpheus8 melt fillers? Not really, especially if you're just doing a treatment in the dermis and the face. I believe there's been a couple of studies done to show that it doesn't really have that much effect. I would always, if somebody's done fillers or done Botox, I would leave at least about kind of two weeks before doing a Morpheus8 treatment. But if you do Morpheus8 first, then you can do fillers a couple of days later. It doesn't really make that much difference. Contraindications. Contraindications, I mean, there are kind of absolute contraindications, so skin cancers and open wounds and things. You would never do it on somebody that's had sort of a skin flap in an area. Autoimmune skin conditions, perhaps. And then relative contraindications would be severe post-inflammatory hyperpigmentation, and maybe what else? Sort of keloid scarring. If you're going to be treating a chest or something, I wouldn't treat in those cases. Yep, so Ian's asking, have you experienced using the new 0.5mm fixed depth Morpheus8 heads? Yes, for acne scarring. These are the uncoated pins, which work in a similar way to Fractora, actually. And I've had that on my own face, and I did see an improvement in the kind of the general luminosity of the skin. It's a nice resurfacing superficial treatment. Energy settings for abdomen, somebody asked. I would say for abdomen, you want to go high, you want to use multiple stacks, overlap, and always I would use 4mm because you want to get some dermal reaction, and you want to also get some reaction in the subcutaneous fat as well. So I would usually use between sort of 45 and maybe 60 joules. As I said, for the abdomen, I always use tumescent local anaesthetic, so it doesn't really hurt at all. And I quadruple stack on the abdomen, so I do 4 pulses with the setting on fixed at this high energy, and I overlap as well. The tip on Morpheus8 is small enough to treat under the eyebrow, but above the eyelid there is, and the way that you would do that is by actually stretching the skin up and then pushing the Morpheus8 head against the bone, and that you can get quite good tissue apposition with that. I believe there is a new tip coming out that's specifically designed for that area that's a little bit easier to use, but you can use the standard one on there. Intensity for the submental area, I would use 4mm, and I would usually triple stack it, and I would use maybe about 45 joules for that area, and again overlapping. So just the kind of triangle there is where I would use those settings. The rest of the neck, usually I would use 2 to 3mm and use a slightly lower setting. Because the issue that I've sometimes seen in people in the necks is they can get this kind of chicken skin appearance afterwards, which can last for a couple of weeks. So I've adjusted things, so I use a slightly lower energy setting. It seems to reduce the risk of that. Can you use Morpheus8 on sagging skin on upper arms? Absolutely. Again, I would use similar settings to on the body, on the abdomen. So high energy and use the deep 4mm treatment. And I would quadruple stack it again and overlap. So yeah. Any other questions for now at all? About settings or IPL or anaesthetic or anything like that? no, it's been, we can call it a day. Is there anybody else wants to share any experience or tips that they might have?
I think we've got another question from Barbara David.
Oh, yep. Another question from Barbara there. Difference between normal tip and resurfacing tip. So as I said, the resurfacing tip is uncoated, which means that you're getting heating along the entire length of the pins. With the coated pins, they penetrate much deeper, so they can go to up to 4 millimeters, and they don't heat along the length of the pins, but they only heat from the tips. So the benefit of that is that you're getting the heat being delivered, or the radio frequency energy being delivered deeper, but not the surface heating. So with the coated pins, you're lower risk of sort of inflammatory changes and post-inflammatory hyperpigmentation on the surface of the skin. With the uncoated short pins, you're actually getting more surface reaction, which is good when you're treating things like acne scars and stretch marks and these sort of things, because you want to stimulate collagen superficially in the skin, or you want to stimulate this reaction and then stimulate the cells to produce new collagen and elastin and mature the dermis in those areas. Let's see. Shall I upgrade to Morpheus? Louise is asking. Yes. Yeah, maybe. I would say that I've noticed a real benefit when I've been treating patients versus when I just had Fractora. All depends on how many patients you're seeing to kind of justify the outlay. But I think that just the amount of coverage and popularity of Morpheus8 is enough to kind of bring it into the public attention, so people do know about it, probably even more so than Fractora, I would say. And I think it is a good addition to if you do have the platform already. Yeah, so I would say I got it straight away, and I like it. So, but it's yeah, the decision is obviously yours. The treatments on the face are painful with a 23.8%. Yeah, I mean, it's with local anesthetic. Patients, it varies from patient to patient. Usually I find with 45 minutes to an hour of Receptura, it's totally fine. There have been 1 or 2 patients that have been still quite uncomfortable from this. So a technique that you can do with this is to remove the local anesthetic with alcohol and then put on another layer, give them a while longer to wait, and then try it then. The other technique that I always use actually when I'm doing the treatment is to pinch the skin and then press the handpiece against it. That's always the way that I used to teach when I was teaching about Fractora, to reduce the amount of pain that people were experiencing. But if you pinch the skin, you're stimulating the touch receptor, the touch nerves, so this gate controls the area of pain, and you actually get a reduction in the pain, the firing of the pain fibers, and I find that has a significant impact on pain levels. So I always pinch the skin like this and push. I don't have a device here to show you. Let me just show you this. So you pinch, and then you put the pulses like this, and that can really help with pain. Would it be possible to obtain the PowerPoint presentation somehow? I can share certain slides. I can't share the slides of the patients because I've not given their consent to be shared. But yeah, I can share the other slides, absolutely. Patients don't tolerate well the procedure. Again, there are these techniques that I would suggest trying if you've not tried them already. Always lowering energy levels if they're not tolerating it, and maybe trying different local anesthetic techniques. If they're not tolerating it as topical, then maybe give a go to nerve blocks. Will the resurfacing tip work with the 2016 machine? I'm not sure. I think my machine is I believe 2015 actually, which I think with the software update, it probably does. What do you charge? How do you charge for a full face? We struggle with prices in our clinic. So I charge for full face and neck 2,900 for 2 sessions. I think it's fine in Harley Street because people are kind of used to those sort of prices and things, and they actually expect it to be that sort of price for a sort of advanced skin treatment like that. I used to do a clinic in Edinburgh, and they'd never in a million years would spend that on a treatment. So I used to price it per session, and I would do about 950 per session for Edinburgh patients. Yeah. Okay. Would I recommend Morpheus8 for upper chest, and what parameters? Depth of needles. So yeah, for the chest area for tightening, you can do similar sort of settings to the abdomen if you wanted to kind of improve the skin and sort of get a little bit of a reduction in that kind of crepiness of the tissue there. I would do usually, so for the very upper part here, which is quite bony, I'd maybe do sort of 3 millimeters around about maybe 30 joules, and I would maybe double stack the pulses. For lower down on the chest, I would probably say 4 millimeters is fine, and you can go higher with the energy levels, and you can maybe triple or quadruple stack it. Yeah. Cool. That's great. Any other questions? I think that's me at the bottom of the questions for now. Anything else, Rosalie or Neil, that you wanted to say? What would happen if we treat melasma? I would, as I said, I'd be very careful about this. Only treat in patients that you've selected that you know don't have issues with post-inflammatory hyperpigmentation, lighter skin types, and as I said, I would pre-treat with hydroquinone. If it works, it can be great. It reduces the melasma quite, in the cases that I've done, quite significantly. There's always a tiny risk that it makes it worse, so I'd always do a test patch first. Yeah. So yeah. To answer that question, do you use any products post-treatment? No. I prefer just to kind of leave the skin to do its own thing after treatments. I don't like anything that potentially could be occlusive or create any sort of reaction on the skin. Definitely don't use any acids or vitamin C or anything like that. I just advise people to leave it for the first 24 hours without doing anything. After 24 hours, use an SPF, so broad spectrum, high SPF, and after usually about with doing nothing, usually by about, as I said, day 3 to 5, they're pretty much back to normal. Even the second day, I did have a video in my presentation, but because it's difficult to share these on this, that showed a patient on day 1, and her skin looked pretty normal. So I think the less that you do directly afterwards, when the skin is a bit inflamed and you're getting that kind of post-inflammatory response, the better. Some people I know do use vitamin B5 on the skin, which can be kind of soothing. And also, if you're wanting to use a mineral-based makeup, then Oxygenetics is totally fine to use, but I prefer just to use nothing. Cool. All right. I think that is probably us. Good. Okay, thank you all for watching, and if there's no other questions, then probably we can call it a day.
Thanks very much, David. That was fantastic.
Yeah. No worries. Thank you all for watching.
Thanks everyone for joining.